All right. Hello, everybody. Sean and Jenna from RPH Ally, and we are looking at the Perfecting Peds show. But first, Jenna, I just want to say Happy International Women's Day.
Oh,
We are
thank
just
you.
we are just so happy that we have so many great women here at RPH Ally, and you're really showing us a way how to collaborate and innovate. So I love it. So thank you. So
Yeah. All right, he's passing it off. So today we're talking about pregnancy as well as nausea. So like how Kevin and I have been doing the shows is we started from preconception to last week was the like whether you know it or not. Once you find out whether it's planned or an oopsie boops, like my third, you find out you're pregnant. And then I said the most times I get a panic text from somebody around like 5 or 6 weeks that just found out they're pregnant and they're like, do not tell anybody because they're so early on, but I am so nauseous. What can I do? So that was what we're going to cover on this episode. And so a lot of times, because they're so early on, and obviously your first trimester is usually when you're the sickest, commonly, and sometimes it goes away, sometimes it doesn't. This will just talk about nausea and vomiting, but it won't go into hyperemesis syndrome, which is a lot of pregnant patients get where they just like keep throwing up. So that would be, we can do that topic. That will be another one. But some really good things to know about pregnancy and nausea is that a lot of times it can be treated with over-the-counter medications, which is awesome because a lot of OBs won't even take you into their office until about 10 to 12 weeks. So you're kind of on your own in the beginning, and you don't have anybody to ask because you don't have that OB appointment yet. So things that you can do, which are simple, there's an actual prescription for it. It's called diclegis. This medication, though, all it is there's a really smart marketing ploy because all it is B6 and doxazolamine, which can be both are given over the counter. So B6, the common vitamin that we all probably take in our multivitamin, but this medication alone is actually super effective at treating nausea. So most of the time you're going to get it just by the dosage forms that it comes in. 25 milligrams is usually enough of the B6, and you take that every 6 hours. If you're experiencing pretty like all my girls, I don't know if it's an old tale or actually true, but girls make you a little bit more nauseous. So, and they drain your beauty. Both things I felt were true. And they're so nauseous and tired. But so B6 at 25 milligrams, and you can take that every 6 hours. And then there's also over the counter what's called Unisom. And I'm looking on Lexi here because they have different titration schedules. But with the most important thing is over the counter, I believe doxazolamine, let me check myself, comes in for the Unisom 25 milligram tablets. And with this, the most important thing to remember is that this is going to make you super sleepy. It's a medication that's used for sleep, and because of that, and it's an antihistamine, so you are going to get super drowsy. So the most important thing is you want to take it at nighttime, and even I'm looking at just making sure, 25 milligrams is what it comes in over the counter. So I would recommend to half that at first because I took 25 milligrams and felt like I was hungover the next day. It's kind of like Benadryl. And so 12.5 was enough it was nice. I slept and enough for me to nick my nausea. However, I could not take it during the day and function because you can actually like titrate it as frequently as every 6 hours, but a lot of people, because of how drowsy it makes you, they cannot. So kind of your cocktail for over the counter is that Unisom you can do a half to 1 tab at 25 milligrams, and then your B6, and you can do that every 25 milligrams every 6 hours. And then other things that are just again over the counter is like ginger. So sometimes you can like there's like ginger, almost like cough drops are the ones that you can suck. They're great. And then this sounds funny, but it's something called a Preggy Pop. And these Preggy Pops are super sour. And so a lot of times that nausea is relieved. You might notice you're like reaching for me, it was Sour Patch Kids, but sometimes that sour actually will help curb the nausea as well. So those 4 are really what's available for nausea. Now, when you get into nausea and vomiting, you can do Zofran, but that is something that is not available over the counter, and you would have to contact your provider for that script. But that's pretty much my little cocktail that I tell for pregnant women so that they can, go and get these things over the counter and not wait until they see their provider or OB the first time.
I love that. I never liked this question when I was behind the counter as a pharmacist. So this is really good for pharmacists to know, coming from you being the Peds pharmacist, Jenna. On the Unisom now is it doxylamine? Is that it?
Yeah.
I can never say that right?
No, me neither.
So is that okay? We're talking first trimester here. Is there any risk in the later, like 3rd trimester, with that one because of the antihistamine and the breastfeeding issues?
No.
Okay, nothing there.
Oh, a lot of people won't need it because like they're usually not nauseous once they give birth. But you can, like, it's safe all the way throughout pregnancy. And then if someone does have trouble sleeping, you can do. Actually, let me just make sure, because I haven't actually been asked that question recently. Benadryl, well, if you need Benadryl, you need Benadryl. But if you're taking it to sleep, I'm actually looking it up on Lexicon, because usually women don't have the luxury of taking something to sleep because they're waking up every 2 to 3 hours breastfeeding. But like I said, breastfeeding considerations.
Yep. I'm sorry, Jen. I kind of put the cart in front of the horse on that one. I was thinking more. So, is there any restrictions closer leading up to pregnancy, as far as or is it? It's been 5 years since my youngest was born, so all this has been lost on me now. Is there anything that affects milk production, or does that all happen after birth? So you don't have to worry about that right up until that happens, right?
Yeah, I wouldn't. And everyone really, some people do start producing some milk like 10 weeks before, but that's usually if you have multiple children. And then a lot of times what's really in the beginning is that colostrum, and not necessarily milk. And so none of this should, and you're going to stop these meds obviously when you give birth. And most women, not all, because it does go all throughout pregnancy, don't have that nausea and vomiting through the last 2 trimesters, but some do.
Okay.
Shouldn't affect it. Yeah, it shouldn't. Taking it during pregnancy shouldn't. It's safe for both the baby and the mom.
Okay.
And the breast milk.
Quick recap here, Jenna. B6, he said 25 milligrams every 6 hours. Drinking plenty of fluids with that, since it's a water soluble vitamin. Is that a good idea?
Yes, always. Okay. Throughout pregnancy.
Yep. And then the Unisom doxylamine, 15 or 12 and a half to 25 milligrams, probably at bedtime, unless it doesn't affect your sleep, right? And then can you go over just the quick last 2, because that was kind of, you were cutting out a little bit when you said those, as far as the last 2, just quick drugs and doses.
Yeah, so these are just over the counter things. So ginger, a lot of times ginger is great. So if you have they have those ginger lollipops or ginger candies. Yep. Sometimes they're really good to suck on. And then something called Preggy Pops, which you can buy just off Amazon. They're really tart.
How do you spell that?
That's crazy.
Did you say Preggy Pops?
Preggy
Pops.
Right?
Oh, Preggy Pops, like They're pregnant. Okay, that makes perfect sense now.
Yeah.
Preggy pops. Okay. No, that's
EGGI and then pops.
okay.
Preggy pop drops, and they're great because they're super sour. They almost taste like a Sour Patch Kid.
Okay.
And sour actually usually cures your nausea too. So they're just a fabulous like over the counter thing that you can try that actually was super effective for me personally.
Awesome. Good stuff, Jenna. I thank you, and we'll catch you everyone here next week for getting into the first or second trimester. Or no, you said you're going to go over with
Hyperemesis syndrome.
Thank you. Perfect. All right.
for patients who are super, super nauseous and having refractory vomiting. So we'll talk about that, and we can actually talk about how pharmacogenomics can be implemented into that.
Ooh, even better. Love it. All right, Jenna. Thank you so much. We'll catch you next week.